Good morning, everyone. Have some in. I just wanted to introduce myself. I'm Lee Raposa. I'm the program manager for the Rhode Island Youth Suicide Prevention Program. Been suicide prevention training in Rhode Island for 2.5 years. I've trained a little over 40,000 adults, educators, members of the school community, and communities in Rhode Island. And I just wanted to let you know that today is actually my last training. Our grant has wrapped up, and so I'm really grateful to be ending in the town that I grew up in. So it's nice to virtually see everyone. As a reminder, we have this training annually as a result of the legislation that was passed, the Nathan Bruno Jason Flatt Act. And what that legislation does, just as a reminder for folks, is it mandated that all Rhode Island school personnel have an annual opportunity for an annual training in suicide prevention. And the second piece of that is that we also have to offer curriculum for middle school and high school students on how to help a peer that might be struggling. And then the last piece of the legislation is to make sure that all school districts in the state have a suicide prevention protocol and plan. So just making sure that people know kind of how we got here. Nathan was a student in another school district and died by suicide, and his family and a lot of us in the prevention community lobbied for legislation to be passed to make sure that you all have the skills and the training to be able to intervene and help a student that might be struggling. So thank you again. We are going to be looking at Question, Persuade, and Refer, QPR, which is an evidence-based intervention for suicide. I know this is a review for a lot of folks because you have been coming annually, and East Providence has been a school district that we've been working with in this capacity, I think, since about 2017, maybe a little earlier. So we are going to review Question, Persuade, and Refer. How to question a young person if they're thinking about suicide, how to persuade them to get help with us as a member of their helping team, and then who we're going to refer to. And a lot of times that's going to be both an internal protocol, and then we're also going to look at referral sources or resources outside of the school building. So for many people, talking about suicide is not easy. You might have your own lived experience with suicide loss or attempt, either with a family member or a colleague or someone in your life. What I did want to say is that 15 and a half years ago when I started this work, a lot of people would whisper the word suicide. And I find that now, because of a lot of the work that we've been doing around reducing stigma, adults are now using the language that our students have been using for many years, and they're actually naming it, talking about it. And what that's also done is send a message to our students that we are people that feel comfortable talking about mental health challenges, and how to get someone help that's struggling. Some of us, like I said, might be survivors, so it's really important to make sure that you're taking care of yourself. I give the example that we use self-care. That became sort of a phrase that we used during COVID. And I've done these trainings before, and educators say, we talk about self-care, we talk about, modeling that with our students, but what about us? Who's taking care of us? And I did want to say that I attended a RIDE conference this past summer, and the focus was on the emotional and physical well-being of our educators, and the focus is now more on making sure that you have the resources and the supports that you need to take care of yourself, because what we know is that if you're tired and you're struggling, that's going to impact how you feel effective in the classroom. So we have come a long way, and we have been listening. Preventionists often experience compassion fatigue. So really what that means is that you might have students within your classroom that have a lot of emotional or physical needs. You might have kids that are really struggling in their families, in the community. It might be more than one or two. So we just ask that you get other people involved to help you and make sure that you're not trying to support these students on your own, because you can experience something where it might really consume you emotionally. So if you have an employee assistance program, which I believe you do, sometimes this might be a resource that you could reach out to for additional support. And that's why we just kind of say, monitor yourself closely, especially in these types of trainings. You might have experience again, so either take a break or, talk to somebody within your team, or I'm always available after the training to talk about things, any cases or experiences that you want to talk through. I'd be happy to do that. Our learning objectives for today, we're going to be increasing awareness of stigma and understand suicide as a public health issue. I will say that I think just by being here and having these trainings annually is already an activity that's dedicated towards reducing the stigma around talking about suicide. Years ago, people would just whisper the word suicide whenever I would come into a training, and now I think that we're naming it, we're using the language that our students are using, and so it was up to the adults to kind of catch up, and I think that we've done a remarkable job. We're also going to look at how to recognize a young person who might be at risk for suicide. We're going to look at how to question, persuade, and refer someone who might be suicidal or at risk for suicide. We're going to access or learn how to access local and national referral sources, which is really going to be 988 and BH Link here in Rhode Island. And throughout the training, we're going to be learning strategies to offer hope in order to save a life. So what is the purpose of QPR? It's not intended to be a form of counseling or treatment. We're not asking you to sit with a student and, providing any kind of mental health interventions. It is intended to offer hope for students through positive action. And that positive action is really leveraging the connections that you have with your students in order to assess, where they're at, what they're struggling with, and then to get them ultimately to someone that can get them help. So I think it's always important to talk about self-care. And I know I mentioned earlier that RIDE has placed an emphasis on making sure that you as educators have the supports that you need or the resources for well-being, both emotional and physical well-being. But this is where I try to explore with you, just try to think of what some of your self-care strategies are. In earlier sessions, I've heard people say that gardening was a self-care strategy, reading, working out, artwork, drawing, walking out in nature, hiking, things like that. I have examples of some self-care strategies here. I have Radar, who is our golden retriever puppy, who's being certified as a pet therapy animal. Through Pet Partners, we have other dogs in our home. Gardening, that was the first sunflower of the season that had bloomed, actually, and I had done a training that day. Spending time in the ocean, and making lasagnas for Lasagna Love as a volunteer chef, which in another session that I've done recently, the staff said, I didn't even realize that was a resource. And so we're all over the country. And if you're ever in a sort of a situation where you just feel like, I'm tired of cooking, you can just place a request in a portal and we'll deliver one. And somebody like me will show up and or you can always be a volunteer. So there's lots of different strategies that we have for self-care. I think it's important to recognize what happens to you when you're not exercising your self-care strategies. So you might a lot of times become more irritable, less patient, just not have as much energy, especially if like your sleep hygiene is off and you haven't, had a good night's rest, or it's been a series of days. So I usually just own that with students and say, there have been some things going on. I've had some stressors, but this is what I'm going to do to get back on my self-care, strategy or my self-care routine. And the other thing, the reason why I mentioned pets is that for a number of you who have pets, how do your pets advocate for themselves? How do they let you know exactly what they need? They might bark. An earlier session, one person said that their animal comes up with them with a cold, wet nose and wakes them up, and that means that they're hungry and they want to eat. And so what happens if we don't meet those needs? The animal is going to increase their behavior in order to get a need met. And so I argue that humans, our kids, our students, our family members, people in our lives do the same thing. They use their behaviors oftentimes to advocate for an emotional or physical need that they have, because they might not have the words or the vocabulary for that. So that's when we kind of sit down and say, what is the student trying to tell us with their behavior? Suicide myths and facts. So think to yourself as I put something up on the screen, whether or not you think this is a myth or a fact. So no one can stop a suicide, it's inevitable. Do you think that that is a myth or a fact? So that is a myth. We're going to replace that with a fact. That is, if people in a crisis get the help that they need, they may never be suicidal again. So another myth or a fact, asking a person directly about suicide will only make them angry and increase the risk for suicide. What we know now is that the fact is that asking someone directly actually lowers anxiety, opens up communication, and lowers their risk. We used to think that asking them would put the idea in their head and that they'd be more apt to act on that thought, when what we know is that just by asking, we reduce their threat level. It's making a connection that you feel comfortable talking about somebody's potential emotional pain. All right, myth or fact, only experts can prevent suicide. The fact is, suicide prevention is everybody's business, and anyone can help prevent the tragedy of suicide. Again, just by asking, just by showing that you have care and concern for that person. You do not need to go to med school or any kind of higher ed training in order to prevent a suicide. Most people considering suicides communicate their intent sometime during the week of preceding their attempt. Do you think that's a myth or a fact? This can be kind of a tricky one, and we're going to use the lens of youth. So people considering suicide keep their plans to themselves is a myth. The fact is that most people considering communicate intent typically a week to 2 weeks, sometimes to 3 weeks prior. They might be acquiring means. They might be sharing writing samples. They might be posting things on social media, Snapchat. They might have a sort of a new interest in something that they've been researching. They go to the library and they're taking out books or literature that has to do with really dark themes or self-harm, and that's different for that student. And we want to take all those things very seriously. So I think it can be sometimes common that we just dismiss things as like, you know what, I don't really think that's much bigger. I'm not going to make it a bigger deal than what it is. But in reality, if we're able to intervene early and talk to the student early about these things, we might prevent a crisis. Lastly, people who talk about suicide may try or even attempt an act of self-destruction. That's a fact. So people who talk about suicide do not follow through with their plans is actually a myth. What we know is that when people talk about suicide, they're actually at higher risk. 90% of people that die by suicide have had an underlying mental health challenge. They've either been treated or untreated, diagnosed or undiagnosed. And so oftentimes these are people in our lives that require a lot of attention, both emotionally and otherwise. They might have a lot of, pending crises, always evolving. So we want to pay very close attention and take those all very seriously. Once a person decides to die by suicide, there's nothing we can do to assist them or prevent that. Is that a myth or a fact? Right. So a fact is that suicide is the most preventable kind of death, and almost any positive action may save a life. So just by asking, we absolutely can intervene. So when you're talking about students, I say, you know what, Ms. Raposa takes everything you say seriously. Today it sounds like you're struggling emotionally and otherwise. My job is to keep you safe today. And so let's sort of explore what's going on, and then I'm going to ask you a few questions. And those are going to be questions that I'm going to share with you just for transparency. So how can I help? How as the educator, school, community, personnel, member, can I help? Just by asking the question, and we're going to review those. You can absolutely help also by recognizing warning signs. So what are some of those warning signs? We're going to look at direct verbal cues, indirect cues, behavioral clues, and situational clues. So once a student says something like, I've decided to kill myself, I wish I was dead, I'm going to commit suicide, I'm going to end it all, if my partner breaks up with me again, I'm going to kill myself. Those are pretty direct, I think we can all agree. Indirect might be more, I'm tired of life, I can't just do this, I don't want to do this anymore, my family's going to be better off without me, who cares if I'm dead anyway, I just want out. I hear that one quite a bit, I just want out, and I'm not going to be around much longer. Pretty soon you won't have to worry about me. Those are all pretty indirect, and I would say that I think we all agree that we would ask and explore what that student had just said in some way. Some strategies might be, what's changed for you? What do you mean by that? What do you want out of? I saw you on Wednesday and now it's Friday and you're a hot mess. What changed between Wednesday and today? Some behavioral clues might be a student has experienced a previous suicide attempt. They might be acquiring lethal means is what we refer to them as. Lethal means could be a firearm, it could be lethal amounts of medication. We might have students who have co-occurring disorders, depression, moodiness, hopelessness. All that really means is that they might have one or more sort of mental health challenges that they're experiencing at the same time. They might start to do things like put their personal affairs in order. And what we notice is that they might catch up on all their assignments. They might do all their, chores at home. They might start to give away things that they're not going to need anymore. Sudden interest or disinterest in religion. Any kind of drug or alcohol use or any kind of substance use, that's obviously a referral to your student assistance counselor as soon as possible, or maybe a relapse after there's been a period of recovery. Any kind of unexplained anger, aggression, irritability. I think years ago, we used to just think that people that were really angry and sort of apathetic were just, for lack of a better term, jerks. But what we found is that oftentimes these are signs of depression. So situational clues, any kind of previous suicide attempt, again, you might or might not know that. I think oftentimes our students are a lot more eager to share what their lived experience is because we've done such a great job of reducing the stigma around talking about their feelings and their experiences. So they might actually share that, this summer they really struggled and they had an attempt, or even over the holiday break. Sometimes students might be fired or expelled from school. And I know I always give this example whenever I've done this training, but I grew up here in East Providence and I went to high school in Massachusetts. And so my part-time job after school, I was brought up Portuguese, was working at Burlington Coat Factory. And so that is where I had my social, group of friends after school. But if, they had done a reduction in force or had they, just laid people off because of lack of business, that would have been a loss of connection for me and for my peers. Any kind of disciplinary action at school. I know that we do more in-school suspensions now. Any kind of out-of-school suspension or legal issues with students, it's really important to make sure that when they are home or they're out in the community and not in school, that there's some sort of supervision for them. A recent or unwanted move. In Rhode Island, that could be moving from East Providence to Cranston, right? So any kind of disruption in that student's connectedness or their disruption in their community, whether that's, their neighborhood, that's where they live, their school community. So if they have to move, it's really important to make sure that wherever they're going, that you're able to do some sort of transition. Loss of any major relationship. Now, this is a huge risk factor for suicide. So when we look at cases, oftentimes we see that there was a major loss in that young person's life. That might be a loss of a relationship, that might be a loss of a parent, a death in the family, a disruption from deployment or from deportation or divorce. Any kind of major loss is oftentimes something that, if not supported, could escalate. So we want to make sure that we're acknowledging if a student has had a recent loss and making sure that they have support around that. Again, examples of loss might be of a sibling, of a best friend group. Diagnosis of a serious or terminal illness. That could be for the student themselves, or that could be for a family member within that student's life, or a sibling or someone that they know or cherish dearly. Sudden unexpected loss of freedom or fear of punishment. So this could be juvenile justice. This could be a young person is experiencing disruption in their placement. Maybe they're involved with the child welfare system. Maybe they have to go live with another family member for a while for different reasons. So there might be different expectations around like their freedom. If they're now in foster care or in a group home, that might look very different for that student based on where they were coming from. Anticipated loss of financial security. So that could be that a parent or a caretaker is about to lose their employment, or maybe they're seasonal employees, right? Or they themselves are actually going to be losing a position based on the time of year. Loss of a cherished teacher, someone who was dear to them and that supported them and that they looked up to and that they've known for a number of years, or a cherished counselor or therapist. Any kind of fear of becoming a burden to other people. That could be a perceived stressor for their parents, and they might not want their parents to have to experience that. So QPR, question, persuade, and refer. So the question is, we're going to look at the direct or indirect approach of asking questions. We're going to look at the actual tool that the schools are using called the Columbia Suicide Severity Rating Scale, which is 6 basic questions that your school support team members have been trained for a number of years on how to administer to a student who might be struggling, that you refer the student to you. You refer the student to them. How to persuade, how to really walk the student through what the next steps are going to be for them to get help. And then refer. Who are you going to refer to in the building and in the community? So asking the question, it might be, again, a Friday afternoon. You might be wrapping up your day and a student might present to you really struggling. You decide pretty immediately it's not appropriate for them to be put on the bus and that you want to get them to someone that can ask these questions. Try to do it in a private setting if possible. Allow the student to talk freely. They might not be ready to share everything yet, but they might be ready to share as much as they can in that moment. So let them just kind of have the space to talk. And give yourself as much time as you can. I know you might not have the luxury for that. And if you can't, then just get them to someone who can. It's not how you ask the question, it's that you actually ask it. That's the most important. So don't worry about fumbling over your words. So we have a direct approach, which we're going to look at right now. It's actually the next slide. So this is the Columbia. So we're going to ask these questions directly and deliberately. We're going to use this kind of language. Again, this might not be you. This might be your student support team members. So your psychologist, nurse, social worker, student assistance counselor. They're going to ask these questions within the past month. They'll ask the student, have you wished you were dead or could go to sleep and not wake up? And the student might say yes. Have you actually had these thoughts of killing yourself? Yes. Have you been thinking about how? Yes, I live right near the train station. I know the schedule for the train, for the Acela train. Have you had these thoughts and some intention on acting on them? So the really important message around these types of tools is that we want to divert families from going to the emergency department or the emergency room unnecessarily, meaning that they might require another level of care. They might not need medical clearance, but they might need an evaluation or a safety assessment, which doesn't necessarily have to happen in the ER or the ED, which oftentimes have a lot of people in the waiting room, and it could be 13, 17 hours before a young person is being seen. So we want to divert families from that environment when all possible. Have you started to work out the details of how you would kill yourself? Do you intend to carry out the plan? So some students might say, yeah, I've written a note, I've done all my homework, I've, made sure that my brother and sister are taken care of after school, I've walked my dog. Do you intend to carry out the plan? So that's where we're kind of looking at intent. So they might say, yes, if my grandmother, who, as we know, has been in the ICU for 2 weeks or 3 weeks, dies, and that is a major caretaker for that person. If it's something that's sort of almost inevitable, if my boyfriend breaks up with me and they've had a tumultuous relationship, that could be a yes. So that it's sort of a pending yes. And then lastly, I know that skips ahead. Have you ever done anything or started to do anything to prepare to end your life? And this is where we say a lifelong question. And some students might say, yes, this past summer, or they're a senior and they were struggling when they were a freshman, and they might give examples of that. So when we have that information, then we call KidsLink and we talk to somebody on the KidsLink line and we start to do a triage. And that means we're going to talk to a clinician. If a student themselves calls KidsLink, they are automatically directed toward master's level clinician who talks with that student directly. But KidsLink is your major resource in the community for making sure that families have the resources for evaluation or assessment for their young person. And we work closely with them as school community members on your support team. This is how we just say, try not to ask this way. Again, there's no super wrong way to ask, but this is just sometimes not that helpful. You're not thinking of killing yourself, are you? It's almost like we're asking the student to give us the answer we want to hear, if that makes sense. You wouldn't do anything stupid, would you? Suicide is a dumb idea. Surely you're not thinking about doing that. So those are just not helpful. They close down conversation with the student. When we're persuading someone to stay alive, we're listening to that problem. We're using all of our active listening skills, which we have as educators, and give them your full attention. So that might mean that you're putting your phone down. You are closing, your device or your iPad or your laptop cover, and you're just actually physically sitting with them. Remember, since suicide is not the problem, it's the perceived solution, we want to make sure that we're kind of opening that up to what are the other options that we have. And don't rush to judgment. And I know that's hard to do sometimes because we might anticipate what an adolescent's experience is because we've been adolescents ourselves, but it's really important to just kind of validate where they're at and that you're listening, and that every student's experience is different. And then just by sitting with them, you're actually opening hope, or you're offering hope just by being with them and attending to them. And then I usually say, you shared a lot. Would you be willing to go with me to, and then name that person, the school social worker, the psychologist, your school nurse, an administrator, so that we can get you help as a team. Will you let me get you help? So you're giving that person the option, but as we know with students, they're minors, so they're going to be getting help regardless, but I like to involve them in that process. Oftentimes people who have been suicidal feel like they've experienced that emotional burden for a long period of time, and they might feel like, who's going to be able to help me at this point? And so this is where we're talking about us as a team, the helping team, that they're not alone in getting that help. 911 obviously is a resource. I will say that whenever I coach somebody to call 911, I usually say, if you know something about the student, they have a diagnosis of autism spectrum disorder, they're nonverbal, they have a lot of anxiety. A lot of times they will be able to send out, depending on their staffing, an officer that has had training in that kind of response for youth. We can always use 988. So 988 is sort of replacing the National Suicide Prevention Lifeline. 2 or 3 Julys ago, we launched 988 nationally. And so there's also a text feature with that. So you can text 988. I often give that resource to people to make sure that they know that they can text or they can call, and they'll be connected immediately with a crisis response counselor. And then finally, local community mental health for adults. You can always call BH Link. That's also connected to 988. And then for kids, you can call the emergency intake at KidsLink, which is 1-855-543-5465. Parents, community members, school personnel, they do not need insurance in order to access this triage resource. And it is the only emotional support crisis line in Rhode Island for families and young people. And then this is an example of some of the folks even in your district that have been trained in that protocol, where we have them ask those questions, those 6 questions, refer to KidsLink, and then ultimately enroll families in a follow-up so that families are getting a call 2 and 3 weeks after their student has been engaged in resources or supports, make sure that the family is still connected, that there's no barriers to care, and if there are, then we look at making sure that the families get re-engaged or we remove those barriers. The best referral always involves taking the student directly to somebody that can help them, and this can be on the field. This could be an after school activity, or a game or a match or a theater production. Always making sure that we're getting them to a trusted adult that can connect them with somebody in the school or out of the school that can get them help. The next best referral is getting a commitment from them to accept help. This is more for our adult population, I would say, because our young people, we're still, responsible for making sure that they're safe. Third best is to give referral information and try to get a good faith commitment that the person is not going to attempt or die by suicide. Again, that's more with adults. I am really persistent, so if I get a commitment, or if I give information, I always follow up and see how that person's doing, and I'll let them know, I'm giving this information. You sounds like you're going to follow through and get some help. I'm going to check back with you regardless the next day. Any willingness to accept help at some time, even the future, can really lead to a very positive outcome. Sometimes people aren't ready to get help in that moment, but it doesn't mean that they're not going to be ready, in an hour or two or, a week or in the future. And then you're also sending the message that you're someone they can circle back with. Remember, since almost all efforts to persuade someone to live instead of attempt suicide will be met with agreement and relief, don't hesitate to get involved and take the lead. Pro tips for effective QPR: I offer a lot of encouragement. I'm on your side. We're going to get through this. We're in this together. And try to get other people involved that are, connected with that student. Somebody in the community, a mentor, religious affiliation. I also want to make sure that we know that the follow-up is really important. So welcoming your student back to school, working with your support team to do a re-entry plan also lowers the risk of suicide for that student moving forward. So after a student comes back from school, they're at high risk for suicide again about 2 to 3 weeks after they come back. So a lot of times their academic stressors are still there, their social stressors are still there. They're starting to learn ways to navigate all of that with our help. And then sometimes they might be getting treatment, which involves medication, and the medication is starting to be helpful to them. But again, the stressors are still there. So it's up to us to make sure that we're checking in and following up and re-looking at that re-entry plan. So it's not static. It sort of evolves as the student comes back. And always just send the message that you care about the student, you care about what's happening to them, and that you're with them as a team member. And when you apply the seeds of hope, or when you apply QPR, you're essentially applying the seeds of hope. And sometimes people will say to me, well, I referred that student, I don't know how they made out, but it doesn't mean that they're not going to have things that are going to be planted as far as resources that are going to sprout later on in life, where just by you intervening at that time, you offered hope that might continue to grow. So I wanted to say thank you to everyone, as always, for supporting the social emotional needs of our students, both in and out of the classroom. And we will make sure that you have my information that's available to you if you want to follow up or ask any questions. And thank you so much, and I hope you have a good rest of your school day.